Hi guys, this video is about optic neuritis. So, optic neuritis is a very important topic repeated multiple times. Let's start from the definition. So, optic neuritis is inflammation or demyelination of the optic nerve, and this results in acute monocular loss of vision. Inflammatory or demyelinating condition of the optic nerve resulting in acute monocular loss of vision. Coming to the classification. This classification is based on the site of inflammation. So, it can be papillitis, retrobulbar neuritis and neuroretinitis. Papillitis means this inflammation of the optic nerve is happening at its head, that is optic disc is getting inflamed. That is known as papillitis. Retrobulbar neuritis means the inflammation of the optic nerve is behind the eyeball. So, the fundus will appear normal because the inflammation is behind the eyeball. Coming to neuroretinitis, it is inflammation of the optic disc with inflammation of the surrounding retina, that is neuroretinitis. So here we can see macular star formation. So this is the classification: papillitis, retrobulbar neuritis and neuroretinitis. Now coming to the etiology. So, the most common etiology is multiple sclerosis, which is the demyelinating disorder. Multiple sclerosis can cause optic neuritis. Then, infections like syphilis, TB, Lyme's disease, measles, mumps, varicella. Autoimmune conditions like sarcoidosis, SLE, Wegener's granulomatosis. Para-infectious, that is following the infection, there can be optic neuritis, and idiopathic. Now coming to the clinical features, symptoms and signs. So symptoms are vision loss, and this vision loss will be sudden, profound, monocular vision loss. So sudden means it is from hours to days. So sudden vision loss. Now coming to pain. The pain is mild dull-like pain behind the eye and it is aggravated by ocular movements. Why is it aggravated? Because there is a superior rectus attachment to the optic nerve sheath. So, during eye movement, the pain will get aggravated. Now, another feature is washed out colors. That is, there is a red color desaturation or decreased brightness. So, there is a desaturation or brightness is decreased. And the next symptom is orthophenomenon. What is orthophenomenon? It is transient worsening following hot shower or following exertion. There will be a transient worsening of the vision. Next, there will be flashes of light induced by eye movement or sound. So, these are the main symptoms: vision loss, which is sudden, pain aggravated by ocular movements, washed out colors, orthophenomenon, hot showers, force pains, that is flashes of light induced by eye movement or sound. Now coming to the signs, visual acuity will be markedly reduced. There will be RAPD or Marcus gun pupil, which is the hallmark of papillitis. Color vision will be impaired. Which color? Red, green desaturation will be there. And coming to the ophthalmoscopy, in case of retrobulbar neuritis, as already mentioned, the fundus will appear normal because here the inflammation is behind the eyeball. And coming to papillitis, there will be hyperemia of the optic disc, blurred margins, cup obliteration and mild disc edema. And in case of neuroretinitis, there is disc edema with macular star of hard exudate. So this is the macular star pattern. Now coming to the investigation, first we have to look for the visual field. We can see central scotomas. In visual evoked response, we can see decreased amplitude and delayed latency. Mainly in multiple sclerosis, we can see delayed latency of the waves. And MRI has to be taken to rule out multiple sclerosis. If there is MS, we can see plaque and Dawson's fingers and all. We can also look for optic nerve enhancement. Coming to the treatment is guided by optic neuritis treatment trial. So, they are saying first we should give IV methylprednisolone 1 gram per day for 3 days. This will accelerate the visual recovery. Following the IV methylprednisolone, we have to give oral prednisolone 1 milligram per kg per day for 11 days. And then we have to taper the steroids. And in MRI, if there is high risk of multiple sclerosis, we have to start interferon therapy so that we can delay the onset of clinical MS. So this is a disease modifying therapy. So this was all about optic neuritis. If you want the full notes, it is available in the Telegram channel. Thank you.